But
working through challenging
not to
times.
interrupt, not to interrupt, but do you think there is a crisis? I get that the people who are working on the front lines are working incredibly hard, but do you think there is a staffing crisis in Ontario healthcare right now?
I think that there should be confidence in the fact that the government, your government, is looking after making sure that we have sufficient numbers coming through. We understand.
Okay, so this is a yes, right? This is a yes, but she can't say yes without looking like an idiot, although she still looks like an idiot. It's a wonderful day in the homiehood, a wonderful day for a homie. Won't you be my homie to Taro? Big news everyone is talking about right now here in Ontario is that DOFO had an announcement, I believe, yesterday to increase surgeries at private healthcare clinics. So let's take a look at this. This is an article from the Globe. We also can like watch a little bit maybe from this press conference, although it's probably going to be pretty trash. And there also is a segment on CBC Power and Politics with what's her name, the health minister Sylvia Jones, this lady who at least is like kind enough to be wearing a mask in this instance. So yeah, let's dig into it and get some of the details. Premier Doug Ford unveiled a plan to increase the use of private clinics to tackle Ontario's surgery waiting lists, which the government pegs at more than 200,000 people. But he says the operations moving to such clinics would still be paid for by the public health system. I love how like this he is like saying like this is like a win. You know, like don't worry, you'll still be able to pay for your medical conditions through your taxes, but you'll probably be paying a lot more. And immediately, you know, like the question is like why do we have a backlog of 200,000 people to begin with? Right? Like why have we not properly invested into our healthcare system in a way that avoids having a backlog like this? Where's the staff, says Ribert here in chat. And the truth is that yeah, like that is the problem that we're facing, is that we've vastly underfunded and understaffed healthcare, so that in order to create this backlog, and you can complain as much as you want about you know, COVID-19 and the pandemic restrictions and stuff like that, but like this is not a legitimate plan in my eyes in order to get out of that. And there might even be proof that this could make things even worse than they already are. So definitely we need to hold Doug Ford and the conservative government here in Ontario accountable. So his government, DOFO, that mofo. Oh, that reminds me, I need to turn on this text. That DOFO mofo. Uh, that DOFO mofo government outlined an expansion Monday of the role of private sector health clinics that focuses first on clearing a backlog of cataract eye procedures, but would then allow existing and new for profit facilities to perform hip and knee replacements starting next year. So, of course, this is like something that we knew. That we people were warning about this when we were in the Ontario election, and they were saying like, you know, like please like do not vote for Doug Ford because he very obviously has a plan to privatize healthcare. And now we're seeing that in real time. And the way that the strategy that they have towards doing that is, you know, underfunding our public healthcare system, creating a crisis that didn't need to exist, using things like COVID-19 and the pandemic as an excuse to say, oh hey, look at like that is why our healthcare system is crumbling, and then turning around and creating these like private facilities that is taking our public health dollars, it's taking our taxpayer dollars to fund a private system. So basically, it's yeah, we're all still paying for it, but it's not going into like the community pot. It's being siphoned away from which just should be a public service. So bomb. Yeah, big bomb for real. Healthcare Health Minister Sylvia Jones would not provide target numbers for how many more surgeries Ontario expects private clinics to do once it's planned, which would also allow not not-for-profit facilities is rolled out. But Mr. Ford suggested 50% of these surgeries could be done outside of hospitals. But why? Like if we have the funding, because all of this is being paid for by taxpayers, if we have the funding to create these private facilities and pay more money to do these in the private sector, why don't we have the money to do it in the public sector? Technically, wouldn't we save a lot of money by not allowing this to fall into the private industry? And they're saying here like, oh, this, don't worry, this would also allow for not-for-profit facilities. From what I was reading, I think it's like 97.5% or something of these are for-profit facilities, and there's like one facility or something that is not for profit, and they're touting that as like some sort of like, oh, don't worry, you know, and who really cares if it's not for profit, because it still means that, you know, we're paying more in the private sector. The Premier and Miss Jones announced their plan at a long-term care home affiliated with Toronto's Kensington Health, a non-profit private clinic that does eye surgery. But almost all of these existing independent, this is the word they're going to use, you know, because it sounds less scary than for-profit. But most of all of these existing independent clinics are run by for-profit companies, a major point of contention for opposition politicians and healthcare unions criticizing the move. As the healthcare system seeks to recover from the strains of the pandemic, Canadians have been experiencing longer emergency room and surgery wait times. Hospitals across the country also have been hamstrung by labor shortages and have hampered efforts to tackle surgical backlogs that grew during COVID-19 waves. Yeah, so like how is this also going to alleviate the longer emergency room wait times, you know? Mary Stiles, who is soon expected to be confirmed as the next Ontario NDP leader, warns that the increased use of private clinics is an attack on public health care. Among her criticisms is what she and others say is the common practice of upselling at existing private sector clinics and that ask patients to pay out of pocket for extra procedures not covered by the Ontario Health Insurance Plan. You know, and like that is the concern. Like if you go to your family physician or you go to the emergency room, and instead of referring you to someone within the public system, they refer you to someone in the private system. And it's like, why you're sending them to someone who is not necessarily looking out for their best interest. They may offer you an excellent level of care, which I mean, I'm also skeptical of, because private does not always mean better. But they also might upsell you and include some additional charges for things that are not covered by OHIP, right? And when you're accessing healthcare, it's a fundamental need. You don't really have a choice, because the doctor is going to tell you like, hey, this is what you need. You need to do this. You need to do A, B, and C. And A and B might be something that's covered by OHIP, but C is something that maybe is like an add-on, right? And the doctor knows it's an add-on and that it's not covered. But you, when you're in this kind of like fragile state and trying to advocate for yourself within this like crooked system, your primary concern is your health. So you say, okay, yeah, let's do A, B, and C because this is my health. This is not something I'm willing to put a price tag on. And you're not even really thinking that there is a price tag, because what they're telling you is that, oh, don't worry, this is all covered by OHIP. So you get A, B, and C done, and then you come out of surgery, and then you get an invoice, which you should not get. And it tells you like, oh wait, C was actually not covered by your insurance program, and you get hit with like an additional fee, which is in a way predatory, right? Because it's taking advantage of people who are focused on their health, and there's really no price tag that you can put on someone's health. So Adil Shamji, a former doctor and the provincial Liberal Party's health critic, said the government offered too few details on how the new system would be regulated, offering instead a Broadway spectacle of deflection and non-answers. The province's 5 largest healthcare unions issued a statement warning that the expansion of private clinics will only siphon nurses from short-staffed hospitals and vowed to fight it. Mr. Ford dismissed the critics for ideology. What does that mean? I like anyways. He said one unnamed CEO told him Ontario's insistence on only public sector delivery of healthcare put it in the same league as Cuba and North Korea. So this is something that's really weird. I already saw people talking about this in our Discord. But like Cuba has like a state of the art modern healthcare system that like should be like the envy of the world because it's all free at point of access. And I mean, even comparing Cuba to North Korea is crazy. Like these are not comparable countries. Um, but then also comparing Canada and Ontario to these countries, like it's like we live in completely different systems. If anything, we should be envious of Cuba's healthcare system. They've done like a fantastic job also responding to the pandemic, and people travel from all over the world to get their medical training in Cuba. So I think Ribert in our Discord said something about uh, Cuba is ranked 39th in the world or something like that for healthcare performance. So it's really not uh, something to be scared about. But I guess what Doug Ford is saying here is like, oh, we should be scared because by only delivering free public healthcare, we're basically living in a authoritarian country like North Korea or a communist country like Cuba. And it's like what is he even trying to say? I think he's really just trying to like scare people, especially people who are conservatives who like don't even have an understanding of like what these countries represent and the political systems that they have. So very strange. A lot of people out there, they want to have the endless debates about who should provide care, Mr. Ford said. All I care about, all Minister Jones cares about, all our government cares about is that you get the care you need quickly and safely. I mean, can we call bullshit on this? I feel like they don't care about us at all. If they cared about this, why have they done such a blatant effort to defunding our public healthcare system? Why have they, through I believe Bill 124, made it so that public sector workers can only have a 1% increase a year in a time that has demanded so much out of them and has forced them to leave their jobs from like burnout and just feeling not appreciated because they're not entitled to the money that they deserve, right? Sounds like an American, specifically a Republican. Yeah, that is exactly what is going on here. It's like it's the Americanization of our public healthcare services. So they're trying to privatize it, obviously, and everybody knows that this was Ford's intention. Even during the election, we knew. After the election, we knew. It's so blatant, and it's just like really frustrating that this crooked government has a majority right now and that like they can do essentially whatever they want, and we're going to have to face the repercussions for the rest of our lives. And one day I sincerely hope that they get voted out of office, but we're still going to have to face the consequences of these really anti-humanist decisions that they're making. The first phase of the plan, the government says, will expand the number of cataract surgeries done in clinics outside hospitals. Okay. With new clinics performing 14,000 extra publicly funded surgeries in Windsor, Kitchener-Waterloo, and Ottawa, this, Ms. Jones said, would eliminate the portion of the backlog contributed to COVID by March. And this sounds great, right? They're eliminating the backlog. But even that in itself is very questionable. Privatization does not mean that does not mean better, right? And we don't know for sure that this will be something that is actually going to be successful in eliminating the backlog, right? And there's evidence to suggest that things could even get worse under this under this privatization system. That being said, let's say in a hypothetical, conservative utopia that they are correct, and this does eliminate the backlog. What happens when the backlog is eliminated? Are these private care facilities, are they going to then switch to being back into the public sector? I highly doubt it, right? If anything, we're going to see more and more privatization, even if this backlog was cleared, because they're going to say, "Oh, look how successful the private healthcare industry is. We should invest more in it. We should use your tax dollars to fund even more of these private clinics." So really, really frustrating. RJ Helms, yo, what's going on? You're just in time for the thrashing here of the conservative Ontario government. So we'll appreciate your input if you got any. As a second step, the province is also boosting the number of magnetic resonance imaging, MRI, and computed tomography, CT scans. So as someone, I've needed to access some of these scans. I'm waiting on the results of my CT scan. Hoping for good news, being optimistic, but I really don't understand why this is something that needs to be privatized. Those machines are really expensive. And if we could just do a better job at using the resources that we already have, instead of funding private healthcare clinics to obtain these machines, I think we would be far better off. The most important thing about having these machines is having the staff in order to operate them. And if I had to go, I don't care if I have to go at 9 p.m. in the evening to get my CT scan. I would, prefer to do that than not have access to it, or have access to it and have to pay more either through taxes or because they've upsold me on some BS than to, not have it at all. Remember back in the 90s, there was a whole thing about backdoor illegal MRI scans. Oh crap, that sounds crazy. Maybe we as a community should buy an MRI machine and start giving some illegal MRIs. How hard could it be? Plus, it will allow these clinics to perform more colonoscopies and endoscopies as early as this year. The third step in the plan requires new legislation to come in February. The government said it would allow more existing clinics and new ones set up via an application process to do hip and knee replacements starting in 2024. The legalization, the government said, would also strengthen oversight and these clinics, strengthen oversight of these clinics, but no details were provided. Of course. Don't worry, we're going to strengthen the oversight. It's like, okay, well, what if I didn't trust you? Ms. Jones said applications for new clinics would also be sought based on the needs of the communities where they would be located. She also said Ontario Health, the super agency that oversees hospitals, would include the news centers in its regional plans. Asked about draining away scarce hospital staff, Ms. Jones said applicants for these new licenses would be required to submit staffing plans meant to protect our public hospitals and to ensure that they are not in any way impacted. So, I mean, once again, the bullshit detector is going off like, it's like an ambulance in my head right now. And it's like, of course, this is going to take away from the public sector workers, especially because the conservative Ontario government right now is challenging in court Bill 124, which has been deemed illegal, that put a wage increase cap on public sector workers like nurses. And as a result of that, they've pushed people out of the industry. If you've already been pushed out of the being a nurse, and now suddenly there's all these jobs opening up in the public sector, which don't have that wage cap, and also are probably going to pay more to begin with because the government is funding these through our dollars. Why wouldn't you go and make more money? Especially now during a recession, during a time when interest rates are skyrocketing and all that jazz, Should see if I can find any articles about it, but it was a public machines being used privately. Remember, your uncle paid for it a few times, says RJ Helms. I think it stopped when they realized they should just run the machines on the books 24/7. Okay. Yeah, I mean, why don't they just, I don't mind getting MRI. If I have to wake up at 2 in the morning to get my MRI or my CAT scan, I'm willing to do that. I don't want this entire private industry to be built off the backs of people who need access to care. Anthony Dale, president and CEO of the Ontario Hospital Association, said the new plan ends the limbo. Okay, first of all, can I just say right off the bat that I don't trust this mofo? That the province's private clinics have been in the 30 years. Okay, I don't really know. I don't care, but don't keep these private clinics in limbo. Just bring them into the public care sector, bringing them into the broader health system. Okay, but this is bringing them into a broader health system that exploits the people who need to access the care and exploits us as taxpayers because we have to pay more for essentially the same level of care, that there's just more of it. He noted that the government says the new clinics in their funding agreements will be required to work with the local public hospitals to coordinate care. A significant number of the doctors at these clinics will also need to be credentialed at hospitals. Okay, so this is like another stupid thing. I don't want the hospitals to have to coordinate care with private sector care facilities. That's just another thing that's going to cost more money and take up more resources. Is that like hospitals have to coordinate amongst their own internal system, but they also have to communicate now with an external system. And there's no guarantee that if you refer someone to the external system, that they're not going to be taken advantage of, and they're not as liable to the level of care that is to be expected. So super sketch. Everything about this, all the excuses they make is just like I call bullshit. And it just sounds like more, really what it is like more, big government intervening on our freedom to access healthcare. They're basically creating more red tape because they're creating an entirely separate sector to essentially do the same thing that our public sector already does. Anyways, Ontario already has 900 independent health facilities, the vast bulk of which are which do only diagnostics. About 10 do more complex surgeries, most of which are cosmetic. Currently, only a small percentage of all outpatient surgeries are done outside public hospitals. The government points to other provinces such as Alberta, Saskatchewan, BC, and Quebec that make more use of this kind of clinic, which is also common in the US. Okay, wow. It's like, oh, well, Alberta's doing it, Saskatchewan's doing it, so why don't we do it here? It doesn't mean it's a good idea, you know? You saw an article saying that it makes sense to put some of these procedures out of a hospital, but into smaller public facilities, not private ones. Yeah, exactly. Like, we can have these facilities because we need them, but why don't they just be public facilities? It just doesn't make any sense. We obviously have the money because we're funding them privately. So why don't we just fund them publicly, since it's our public dollars that are funding them either way? Important to remember that GP's office is a independent health facility. A general practitioner's office is an independent health facility. I didn't realize that. Yep, this is what you get when you elect conservatives. Robert, it's really disappointing. Questioned repeatedly by reporters, the health minister wouldn't condemn upselling, which critics say is a common practice, and sees cataracts patients offered enhanced lenses not covered by OHIP that can cost hundreds of dollars. You think that's going to happen? You think these private companies are going to try to make more money? Will be shocked if this happens, Mrs. Jones. Mrs. Jones would only say that patients charged but never given the option of an OHIP covered procedure can file complaints with the Ministry of Health. Bob Bell, former Ontario Deputy Health Minister and hospital CEO, said many outpatient surgeries should be moved out of hospitals, but only to nonprofit centers connected to hospitals. And I mean, not just nonprofit, but also, shouldn't they be public? Like, even if they are for profit, that money should be going back into the public coffer. The Ontario Medical Association has made a similar proposal. It said Monday it looks forward to working with the government to ensure its changes do not harm hospital staffing. Okay. I'm pretty skeptical. Dr. Bell warned that the government's changes may entice hospital staff to leave for better working hours or pay or more pay. Yeah, obviously. Who wouldn't leave for more pay? That's the same guy in the article I read. Yeah, I did look him up on Twitter, and he had some interesting takes there. Dr. Bob Bell, right? Yeah. Um, and given the challenges of COVID-19 and the government's cap on public sector wage increases, which is known as Bill 124, and currently in limbo after being struck down by a judge pending an appeal. Like, they're actually appealing this Bill 124, which is basically like an anti-worker bill, right? Nurses are extremely dispirited in Ontario because of Bill 124, he told the Globe and Mail Monday. The limitations for doing surgeries in Ontario hospitals are not surgeons. It's the number of hospital staff and nurses. Speaking in Saskatoon, okay, this is a really important point. It's the number of staff. It's hospital staff and nurses. It's not a limitation of the facilities. We have the facilities. We need the staff. We need the operations. This is something that we were talking about yesterday when we were talking about transit, public transit, is that new governments or governments in general, they love to do these new grand projects and build things, but they don't like to fund the day-to-day operations, right? And that's exactly what's happening here. We have the facilities. We need to fund the operations and the staff to operate. But for some reason, we don't have the money to do that. But we are going to pay in these private facilities with our OHIP card. So don't worry, folks. You're still paying for it, and you're paying more for it. So it's absolute BS. So here's JT's response. Speaking in Saskatoon, Prime Minister Justin Trudeau said his government will continue to watch as provincial governments respond to the healthcare challenges they're facing. Mr. Trudeau didn't directly respond to Ontario's plan for the increased use of private clinics, but he said there is a need for more money in the system and that he hopes to announce positive steps forward in the near future. Federal NDP leader Jagmeet Singh criticized Mr. Ford's decision, saying in a statement that it will cause longer waiting times for patients. Mr. Singh said world-class healthcare is best achieved by rebuilding a public system, not by allowing conservative premiers to decimate it with American-style for-profit health corporations. So here, it's nice to see Jagmeet Singh being hard on this. I'm a little worried about Justin Trudeau's response here. It sounds like he's making room for Doug Ford and the provinces to be getting away with this course of action. So, okay, there is a little video here. I think
Ontarians are still waiting
of the press conference. So, sure, why don't we watch it?
Ontarians are still waiting too long for their treatment for surgery, and more needs to be done.
Okay, well, what are you doing about it?
Community surgical and diagnostic centers have been valuable partners towards our pandemic response and addressing the surgical backlog.
Oh my God, you might as well replace her with an AI the way she's speaking. Most hospitals are nonprofits too. The government directly owns effectively no healthcare facilities, says RJ Helms. I don't like that Singh had to bust out the phrase American style. Feels like scaremongering, not a meaningful criticism. What Ford's doing is shitty, but it's not American style. I guess it's true, I think, but I think we kind of do need to be scared a bit. I guess it's not American style because you are paying with OHIP, but the privatization of healthcare and ending up like an American system is kind of something that does light a bit of a fire under the asses of Canadians. So I don't know. I'm fine with the scaremongering in this case.
That is why we are taking further action and releasing a 3-step plan. A plan that speeds up how quickly people are able to get publicly funded surgeries and procedures using their health card.
Oh my God. She sounds like a robot.
Step 1 will urgently address the existing backlog for cataract surgeries, which has one of the longest wait times. New partnerships with...
You think they're targeting old folks with that? Being well, you know, you got to get your cataracts.
Community surgical and diagnostic centers in Windsor, Kitchener-Waterloo, and Ottawa will add 14,000 additional cataract surgeries that will be performed each year.
Okay.
Step 2 will see the scope of community surgical and diagnostic centers expanded to address needs on a
Okay,
local
we
level.
already read all of this. Like, we already learned that what they're doing, but you know, they're not really addressing the root of what's happening. So here's Doug Ford. This is like a 27-minute press conference, so I don't really want to watch it. I'm hoping we can maybe just fast forward to some questions at the end. Okay, sounds like they're asking questions. I do want to watch them flounder around a little bit. Okay, let's.
Additional capacity at the hospitals, change people's
that
or their
Okay, we got questions.
We'll have
politicians.
tell us, share with us how you are doing this.
Sure,
Now
maybe let's
we
just
can
watch from
say,
here.
here is the appropriate place
Can we watch
because
it
it is a
faster?
routine surgery. Here is the appropriate place because it is a high risk. And
Laser or something.
they can laser half my stomach away. That's what I'd like to see.
And I wanted to ask this as a follow-up just about that. When we're implementing this, the safety piece, the inspections piece, there was a previous round of trying to add to the number of IHF.
Entertain
the hip.
God damn, this is just
the
way
same
too
kind of
boring.
facilities.
I can't sit through this. It's like this, like watching this press conference is, I don't think, gonna be of any value to anyone because it's just gonna be them beating around the bush, you know. I am more worried about Trudeau's response because you know, I'm not really an expert, but from what I've seen from other people on Twitter and whatnot is that there could potentially be a challenge for the privatization of healthcare under the Canada Health Act. So I don't really know. I'm hoping to like learn more about this, but what is a bit
The premier is coming from the health sector. Holy Christ! I just swallowed a beef.
yeah. But so this is also a bit concerning because like of course we want this to be challenged, and since we have a majority conservative government here in Ontario, there's only a couple ways that we're going to be able to challenge this. One of them is you know, I think storming Queen's Park and protesting and maybe having the healthcare workers walk out or some sort of labor action. But as we saw kind of with the it's not the OHIP union, but as we saw with like the unions kind of back in whenever, I don't know, I was undergoing chemo, we didn't cover it on this channel, but you know, it wasn't really a strong enough labor movement to be creating any meaningful systemic change. So the other way that we can potentially create change is that, you know, maybe Justin Trudeau or other levels of government. Oh yeah, QP. That's the one. Thanks, Sunnyside. You know, the QP protest, it really just like wasn't strong enough to be the challenge to the Ford majority government that we needed. I'm glad they were successful in their own right, and we can't, you know, ask them to be the champion of our cause when they are, you know, looking out for themselves as well. But it was a bit disappointing that there was no major labor action that could hold the Ford government accountable. So the other way, I guess, would be for Trudeau to do something, you know, and they've been kind of passing the buck off on each other. The Ford government saying they need more help from the federal government, and Trudeau saying that, well, Doug Ford and the Conservatives are not really willing to play ball in a way that meets the requirements that they need. So they're like, they can't just like give them the money when the Ford government's plan is to privatize our healthcare system. So this is a bit concerning though, because I feel like Trudeau has kind of like backed down in a way, or at least that is my impression. Trudeau suggests positive news on health care talks with provinces could come soon. There's a need for more money, Trudeau says, of the pressures facing the system. Yes, there is a need for more money, but I think the concern is like, what are we going to do with
It
the
is one
money,
of the primary responsibilities of the federal government in matters of healthcare delivery to ensure that the Canada Health Act is always respected. That's what we're going to continue to watch across the country as people are responding in different ways to delivering better services to Canadians in healthcare.
So very light language here. He's not saying, hey, we're going to use the Canada Health Act to like put pressure on Doug Ford to make sure that he's doing this right. He's basically just saying, we're going to make sure it's respected, right? There's like, it's not a very aggressive language. I wish he would just like, fuck Doug Ford, like bring the hammer down on him.
We know how important it is to continue to invest in our healthcare systems, and I've had some great conversations with a number of premiers, including Premier Ford, and Premier Moe's been working very, very hard as well as part of a small group looking at improving healthcare across the country. And I can say we're all very much on the same page. There is a need for more money.
Like that to me is really concerning. They're all on the same page. That makes me think that they're all in cahoots here to like privatize our healthcare.
There is a need for more delivery of results for families, whether we're talking about more access to primary care doctors and teams, whether it's quicker access to mental health supports, whether it's reducing the surgery backlog. There are lots of things that we're working on with the provinces, and I look forward to being able to announce positive steps forward in the very near future.
Okay. Wow. So again, like it's like really weak. I don't know. I guess Trudeau is in a position where he feels like he has to play nice with the premiers, but at the same time, I would love to see him just like put some pressure on them. It's just like, here, asked whether he'd accept a deal with federal strings attached. Moe said federal and provincial priorities on the file very much line up. Okay, that's a bit concerning. Strings attached is not the ideal term I would use. Our priorities are most certainly aligned, he said. So I don't know. Let's see what they say about Ontario here. It's got to be somewhere in here. Asked about Ontario Premier Doug Ford's plan to send more publicly funded surgery, such as knee and hip replacements, to private hospitals and reduce wait times, Trudeau said it's the federal government's job to ensure the Canada Health Act is always respected. Okay. So it's kind of like a political response. He didn't say yes or no. He signaled, however, that he's open to ideas that deliver better services to Canadians in healthcare. So he's like basically like, yeah, probably. He's like, we're going to make sure the Canada Health Act is respected, but I'm open to ideas on how to not respect it. Okay. Thanks, Trudeau. So, am I happy that hopefully what I do want, of course, is for the federal government to better fund healthcare, but without the necessary like strings attached, I think it's kind of like a bit of a fool's errand and a waste of money. It's basically, even if it benefits us in the short term, it's going to screw us over in the long run. So, let's see. There is also this interview here from Power and Politics CBC that I wanted to watch. Hopefully they actually like play a bit of hardball. I feel like there's just been not enough pushback at all on this. Unfortunately we're gonna have to listen to Sylvia Jones talk a little bit more, and her voice is awfully droning.
Minister Jones, thank you very much.
RJ Helm says, I don't think there's anything in Dafoe's plan that violates the Health Act. Trudeau could amend the act, but he's an effing coward. Okay, true. Yeah, I don't know. I really don't know enough about it. Yeah, I guess amending the act, that would be really nice. What I just want to see is like action. Like just like don't let them get away with this. Like if this is like immoral, even though if it's legal, that's one thing, but is it moral? And should we be allowing it to happen? Or like is Trudeau just gonna like hang Canadians out to dry along with Doug Ford and the Conservatives? And at the same time, what really is the difference between all of these conservative premiers, conservative governments, if Trudeau is just gonna like give them what they want, right? Like there should be pressure.
Much for speaking with us. I'd like to start by asking, can you explain how
I
this
think
new
this could
plan
be a little louder here. Let's see.
will not end up pulling staff out of already short-staffed hospitals?
Yeah. How?
Absolutely. So, a
Absolutely.
couple of things. First point, most importantly, is we have already seen a historic number of nurses being able to be licensed in the province of Ontario through the College of Nurses in 2022. We've done that work. We have, through our work with the Ministry of Colleges and Universities, added more spaces for individuals who want to become healthcare professionals in the province of Ontario, including a Learn and Stay program that pays for their tuition and their books. As a result of those changes alone, we've already seen increases in the number of nurses and other healthcare professionals who are practicing in the province of Ontario. We are also, in the longer term, of course, 2 new medical schools are being built and planned in the GTA, historic new changes, because we understand our health population, Ontario is growing, and we're aging. So we need to be prepared, but we're also doing some short and medium term goals to make sure that we have sufficient individuals who wish to practice in the province of Ontario.
Okay, so you notice like she didn't answer the question at all. The question was like, how are you going to ensure that these private facilities are not pulling away from the public sector? And all she said was that, well, there's going to be more nurses. Don't worry, there's going to be more nurses. And it's like, okay, but how are they going to end up in the public sector and not the private sector? And how, is the answer just more nurses? We already seem like vastly understaffed.
I get that you want to get more nurses on those front lines, but school, even though that you're listing that as a short-term solution, that does take time to get people through school, get people trained and qualified for this. So if, in the short term, when these changes are happening in the
Okay, here we go.
immediate term, as this is being rolled out, where will these facilities get staff if not from hospitals?
So again, we've already seen over 6,000 internationally educated nurses licensed in the province of Ontario in 2022. We have hundreds of people who want to practice in healthcare in Ontario. We've now worked with the colleges, whether it is the
Oops.
College of Physicians and Surgeons of Ontario.
Oh no, CBC, what have you done? Okay, here, back to full screen, sorry.
Or the College of Nurses of Ontario to make sure that those applications are assessed and, if accurate, ultimately approved and licensed. So we've seen that work happening now, and that work will continue through those 2 colleges. But I wanted to highlight that we've done work both in the short term and the long term to make sure that Ontario is basically ready for the population increases and our aging population.
I mean, anyone who's engaged with the healthcare system as of late, like this, like her confidence is so alarming. It's like, don't worry. Like, how are you? Like, don't worry, you're gonna be okay in the short term and the long term. Like, bro, like nobody's okay like in the present moment. So like having someone like with like deadpan eyes and robot voice telling me everything's gonna be okay is not very reassuring.
Do you think there's a crisis in frontline healthcare staffing right now in Ontario?
I think that there are individuals who have worked incredibly hard for over 2 years to make sure that we had a protected population. They were
So she can't say yes, right? Because like if she says yes, then that means that the crisis is her fault.
working through challenging
Not to
times.
interrupt, but do you think there is a crisis? I get that the people who are working on the front lines are working incredibly hard, but do you think there is a staffing crisis in Ontario healthcare right now?
I think that there should be confidence in the fact that the government, your government, is looking after making sure that we have sufficient numbers coming through. We understand
Okay, so this is a yes, right? This is a yes, but she can't say yes without looking like an idiot, although she still looks like an idiot.
that it has been challenging, that it is very challenging and important work. But we've also seen how people and individuals have stepped up to do that work. And you have a government who's making sure that we have put the policies and changes in place to ensure individuals who want to practice in Ontario can do so. And, Katie, we've seen it because when we made changes with colleges and universities to expand the number of spaces for nurses and offer the Learn and Stay program, we've seen historic number of applications.
Historic numbers. Sweet. Thanks for subscribing for the 7th month, RJ Helms. Much appreciated. That means I can lie here and recover. So I really appreciate that. No thanks to Sylvia Jones, of course.
So it is working. It will take time for some of these other changes, like training new nurses in colleges, but we've also seen it through historic numbers of applications and licenses being given in 2022.
As I move
Okay, get her ass. Like, just
on to the next question, I'm
destroy
going
this
to note that
lady.
you did not specifically answer that question. I'd like to play a clip for you of a guest we had on CBC News Network earlier today. It's from Dr. Steve Flindahl, a York Region emergency room physician. Have a listen.
There is not a lot of doctors and nurses sitting idle throughout the day or unemployed currently that are going to be able to fill these positions. They're already employed. All the surgeons in Ontario are actively working in hospitals funded by the public system. That's the only place.
Wonder if private clinics will accept Prime subs as payment. Only the ones that are funded by Amazon
Are going to get them.
What do you say to Dr. Flindahl?
Well, what I would
And I mean, here's like another person saying like, hey, no, there's no idle workers. There's no secret workforce who isn't already out there just like sitting on their bums at home, like ready to take up arms while the healthcare system is in crisis. And while you're actively oppressing and like limiting the amount of money that those essential workers can make. There's no one out there. So what does she say to this?
Say is we have existing systems in place with community surgery and diagnostic. We have over 800 facilities across Ontario, and all of those have stepped up and said, we would like to do more, we can do more. I was at the
Why would they like to do more? It's because they want to make more money. Like that's our money that could just be going back into the system that we're already paying for.
Kensington Eye Institute with Premier Ford today, and they have already committed and have offered now cataract surgeries on Saturdays, which they weren't doing before they were funded. So we've put those changes in place to make sure that existing community surgery centers can operate more if they so choose, and individuals and organizations like the Kensington Eye Institute have done that.
Now, this is public money used to pay for procedures performed at private care facilities. Why not use this money instead to pay increases to nurses and other frontline workers in order to retain staff?
Yeah, that is a great question.
Well, frankly, we have. We, of course, offered and gave the $5,000 incentive and retention bonus for nurses who are working full-time through the pandemic because we understand how challenging it has been. We have, through previous years' investments, $300 million was provided to Ontario hospitals who believed and knew that they could deal with some of the backlogs of surgeries and expand either the number of hours or the times that they were open. That has already happened. Those investments have occurred, and we're seeing those changes be very positively received.
Man, I really wish they would just like pull out a graph and like call her on her BS.
Minister of Health, what is your position on doctors at private facilities upselling to patients?
So I think it's important that we talk about patient options, and I will give some very specific.
We can talk about that, but I just what is your position? What is your position as minister on doctors upselling at private facilities?
So I'm going to give you a very specific example, and that is, first of all, I want to
wait. An example is not a position.
Reinforce safeguards that already exist to ensure no.
Oh, she's so slimy. It's like I feel dirty just watching this.
Extra charges for OHIP funded services occur. However, upgrading of wheelchairs, perhaps choosing a private room over a semi-private room, or as it relates directly to cataract surgery, hospitals offering an upgraded lens as an option that patients can choose but are not obligated to choose. Those exist in both the community surgery centers and our hospitals.
that, like, this is all well and good. Like, hey, more options, like, you know, it for the right ears that translates to like, oh, better services. And hey, I have the money, so why don't I just pay more? Um, but it's like, yeah, RJ Helms, she's right. This is all stuff that happens in existing facilities, and you're not gonna have to pay more, or well, through your OHIP, you're not gonna have to pay more for those things or pay out of pocket, right? Like, and also in practice, that's not how it works. If the person who's in charge of your care has an alternative incentive to upsell you so that they make more money, they're going to try to do that. And at that point, doesn't the trust deteriorate because you don't actually know if this person's focus is solely on your care because they have an ulterior motive to stack some dollar bills behind the back in the background?
So you support the upselling of services at private facilities?
Well, I wouldn't call it upselling of service. I would call it patient options because, as I
Well,
said,
it's options
when
that's not, the thing is, it's options that's not necessarily available to everyone. People who don't have the funds to pay that extra money for that extra service, or we're talking about lenses. If there's a better opportunity for a better lens, you have to have the money to pay for it. So is that not creating a two-tier system where people who have the money, and if that's what they want to do with their money, that's their prerogative and they want to do it. But does it not leave behind the people who can't afford it, that they don't get those same options as the people who can afford it?
Boom. Okay. Good. Great question. I'm sure she's got some slimy way to get out of this, though.
respectfully, Katie, no. I've given you some very specific examples. When an individual chooses to decide whether they want a semi-private room or a private room,
Chooses with the money that they have or don't have. So if you don't have the money, then you don't have a choice.
that is a patient option that they make.
But we're
They
talking
are
about lenses.
still
Let's talk about the
funded.
first example you brought up, lenses, when it comes to that cataract surgery. If people have the money, they can pay for a better option. If that is something that they will live with for the rest of their lives. If people have the money, they can do it. If they don't, they can't.
But these are options that are available to the patient with a conversation with their surgeon, with their family practitioner. They are optional, they are not absolute. And again, safeguards already exist. OHIP funded procedures occur, whether it is in hospital or in our existing cataract surgeries.
I'm just hoping you can give us some benchmarks for when you hope to see, what's a timeline here for when you hope to see improvements in the backlog?
So we've already given some expanded
Yesterday, we already
licenses
did it.
in Ottawa, Kitchener-Waterloo, and Windsor, and we expect by March of 2023, so March of this year, we will be at pre-pandemic levels for our
March of this year, we're going to be at pre-pandemic levels? That's like 2 months away.
wait times. It's not good enough. We want to do better, which is why we're continuing to expand and offer proposals, assess proposals to see where there are other opportunities to deal with those wait times to decrease them. Look, at the end of the day, this is an individual, a patient who's waiting for cataract surgery and cannot be part of their community in the full extent that they would want. I want to make sure that we get that access happening quickly.
Minister Jones, thank you very much for your time today.
Stay well.
Stay well. Jeez. Why do I feel like she's lying? She wants us all to die. Oh, that's so painful to watch. I hate Sylvia Jones so much. I've barely even ever heard her talk before today, but I've concluded very quickly that I hate her. Getting to chat here. When your dad got cataract surgery at a public hospital, they totally offered him premium lenses out of pocket. I guess what frustrates me about this whole conversation, we're mirroring what Dougie is doing with what already sucks about healthcare and what sucks in other places. Yeah, I agree. I hate that too. And I mean, it's like a common thing that we're talking about here is that like when something is like even more under attack, it doesn't leave any room to self-diagnose and kind of like criticize the existing system. It's like now we have to defend a system that is already not good enough because like we're put on the back heel. Like it is a valid criticism, but it's not new to the situation at all. Yeah. Okay. That's a great perspective to hear. So thanks for that, RJ. If you look at grocery stores and as an example of privatization and what happens to prices, they aren't real options at all. That's right, because these are all essential services and essential goods that we need, right? Like you can jack up the price of food, but it doesn't really matter. We're forced to pay it whether we're rich or we're poor. And for a rich person, they don't feel it at all. For a poor person, that money is coming from somewhere else because of course, they still need to eat. Just like if you're a rich or poor person accessing healthcare, you're a rich person, you don't feel it at all. You're a poor person, and you have to then make choices. You have to then make choices between eating and getting the care that you need, right? Or sacrificing some other part. You have to sacrifice your kids having clothes or getting the care that you need. So it's a lot of BS, and we, unfortunately, yeah, now we are championing. We have to rush to the defense of this already very bad system that is not even fully public or or fully universal in its applications right now. So are just saying, yeah, exactly. I think that's the real goal, to stop us from asking for anything better. Yeah. And like that is always the case. It's like it's just constantly wearing us down, constantly deteriorating us. It's like we're always fighting for better and we're always getting worse. And so then the new status quo that is even getting even worse, which we weren't even in favor of in the first place, suddenly we have to defend that. And it's just like, we're constantly deteriorating under this like neoliberal, progressive conservative provincial government. And it's not. We should be fair, right? And I wanted to talk more about this, but I think we're out of time. It's just that this is a problem that's happening at all levels of government. It's really fun, I guess. It's more fun to just point the finger at Doug Ford, but this is a responsibility that is like the federal, provincial, municipal, all levels of government actually need to come together and fix this healthcare system that is in deep crisis. So it seems like that really like nobody is kind of stepping up to the plate, and the only move that we have, because when in a crisis, a government is going to default and go to like what is their bread and butter. The bread and butter that we have here in Canada is, oh, we're going to neoliberalize, we're going to privatize, we're going to make our public services private services, because and we're going to use the poor people's money to benefit the rich people, because that is the only move that we have. That's like all we know here in Canada. So it's been an issue for over 30 years. Ribert says, I think it's been an issue since like the inception of Canada. Tommy Douglas probably rolling over in his grave.